Namaskar, everyone. I request everyone to please switch on your videos. So, friends, this program is about introduction session about cancer rehabilitation through yoga and integrative healing. It's a teacher training program which is for 55 hours and will be completely delivered on through Zoom channel. So, this program begins on 23rd of August. So, friends, before we talk about the course module, teachers, or how the content will be delivered, I want us to begin with one simple question. When a person living with cancer comes to a yoga teacher or a wellness professional, are we truly prepared to support them? Many of us have the intention to help, but in cancer care, intention has to be supported by knowledge, sensitivity, and responsibility. And this is really where this training begins. Why does even this conversation matters that why we are talking about it? So, friends, first of all, cancer is not a niche health concern, and the numbers what you are seeing on the screen, these numbers are difficult. And honestly, I don't want to spend time on statistics also. How common is cancer? But I think what matters here, when you see these numbers, what matters here is behind every number is a person living through diagnosis, treatment, uncertainty, fatigue, fear, cancer, fear of recovery, or survivorship. So, for us as a wellness professional, the question is, as a wellness professional, what role can we responsibly play? So this question really matters. This conversation really matters. Rather than going towards the statistics, I would ask you to ask yourself that what role I can play as a wellness professional. So past 2 days we did an IG live, and it's very much available on our Instagram channel. There we had two beautiful guests, and they are also mentor of this program. And one thing they specifically highlighted is that the person who's affected by cancer is bigger than the diagnosis. So, friends, it is very important for us because it is natural that as soon as the person is affected by cancer, we completely go towards our concern starts around the reports, diagnosis, medical treatment, medicines, and somewhere that person disappears. That person's individuality disappears. So we have to first understand that person in front of us. And as I said before beginning of this program also, that as a yoga therapist, as a wellness professionals, we all are compassionate. That yes, we really want to help. But friends, karuna is not enough. Compassion is not enough. Sometimes the most compassionate thing a yoga teacher can do is to recognize that where the practice should not be given. What can I avoid today? What can I modify today? Where does my role as a yoga professional end? What happens when somebody is undergoing a treatment? Yoga here remains as a complementary care. We are not replacing treatment, but we are actually learning how to support them better. And for that, clinical awareness, knowledge really matters. Right training really matters. So, as I said, that we understand that there is a gap, and the gap is that people are not ready to care. People are passionate about to care these people, to care, give them the hand holding. But the gap is preparation. So, as a foundational teacher training goes, we learn asana, pranayama, philosophy, and teaching skills. But when a person like this in front of you is going through a cancer treatment or recovery, suddenly different sets of question appears in front of you. What are the contraindications? What are the red flags? How do treatment change? What I can offer? What should be modified? So I always say that these specializations, what Haloma Yoga is offering, is not to take away your yoga foundation. It is purely to help you how to apply that foundation responsibly. What this TTC is designed to build? This, honestly, I would like to tell you and warn you that this is not collection of asanas. Absolutely not. We want you to develop a way of thinking. First, understand the person who's walking in. What is their condition? Then assess them, adapt, support, communicate, change your practices accordingly. What you are, as a person, what you are advising them, change it. Because here, as you assess, adapt, support, and communicate with them, you will also grow a confidence to take the right decision to help them. Because in therapeutic teaching, good teaching is not knowing the maximum number of techniques. It is also about knowing what is appropriate, when it is appropriate, and when not to interfere. Talking about the technicality about this program, this is not a passive self study. It is 100% live Zoom learning where you will get in direct access to mentors. There will be interactive learning. There will be constant question answer sessions with the teachers. Yes, there will be recordings given to you. Recording remains available for revision on your dashboard. You will be given extended access to the recordings post the program as well, because everybody know that this program aims to offer you a hand holding. Talking about our mentors, we have 4 different mentors and there are 5 modules. The first module talks about cancer physiology, treatment context, and red flags. And that is taken care by Dr. Balaji, who offers a medical perspective as an MBBS. Our second and third module is taken care by Saraswathi Vasudevan ji, and she offers applied yoga therapy and psychological and emotional healing under Yoga Chikitsa perspective. A third module offers you Ayurveda, recovery, lifestyle, and supportive well-being under Dr. Pankaj Chansarkar's mentorship. A fourth module is very critical because after learning so much, after spending 50 hours with the teachers, now how to put this information, how to apply this information is where our fifth module with Rita Date comes into existence. So, friends, you are not learning one person methodology. You are learning to see that individual through multiple lenses. So, I would now like to invite our module 2 and module 3 mentor, Saraswati Vasudevachi, on the screen. She's founder of Yoga Vahini. She's a senior yoga therapist educator. She specializes in therapeutic yoga, adaptive practices, and mind-body healing. So let me invite her. I'm stopping my screen sharing and I request Hello My Yoga team to please spotlight her. Thank you so much. Namaskar, ma'am.
Can you hear me?
Yes, we can.
Hello, fellow mentors. Nice to be here. So I just wanted to talk a little bit about the second and third module that I will be mentoring, facilitating. First of all, to look at yoga therapy as not something separate from yoga, from the philosophy of yoga, from the practice of yoga, the understanding of yoga, because all yogis were essentially healers. So whether you look at the South Indian tradition of Siddhas or Patanjali himself, who was venerated, who is being venerated for being a healer, Yogena Chittasya Padena Vacham. This is a very popular prayer to Patanjali, attributed to, I think, Bhojaraja. So yoga for the mind, and he's believed to have given the Ayurvedic science for healing the body. And in the Yoga Sutra, Vyadhi or illness is considered an impediment to the spiritual seeker. So essentially, when we're looking at healing, we cannot separate healing from the spiritual process, right? And healing is essentially becoming whole, becoming a complete human being. And illness is a pathway, I would say, to this healing process, to the transformational process, where one comes back to oneself. When we are hit by health issues or any kind of dukkham for that matter, we start asking important questions about life. Until then, we just continue to live and at the surface without even rooting ourselves into life and the life processes and the intelligence that life offers to us. But when there is a huge hit by any form of illness, and if it's not like an illness like cold or cough, when something hits us deeply, then we start asking these questions. What is the purpose of my life? What am I living for? Why am I here? What is life? What is death? And these questions are very important for us to ask. So essentially, I would look at illness also a pathway to self transformation. And this is where yoga comes in as a very holistic system. So, not even looking illness as a problem, but looking at it now that it has come, I have to learn to accept it. And acceptance is not resignation. Acceptance saying, yes, it is there, it is very real. Now, what can I do about it? How can I understand it? So, the pathway of yoga is about deepening self awareness and understanding of what is happening to me so that I can take charge of my life. I can be empowered. And the role of a teacher or a therapist or a wellness professional is to facilitate that process of self empowerment, self awareness, self understanding for that individual. Then one learns to see that illness is a part of me, it is not the whole of me, right? There are many other parts of that individual which are functioning very well, and one has to be able to recognize it, because the impact of the illness and how it impacts particularly our mind, our emotions, sort of tends to cover up everything else. And then, an outsider, somebody even a part of the family, sees that person as a cancer patient. That person has a number, maybe they have a register number, they're just seen as a part of the statistics, but it's a whole individual, and cancer is part of that person. It has impacted one part of the person, maybe the body, maybe the mind, the emotions, all of that, but not the whole person. Now, how do we help somebody to integrate oneself, becoming whole again from the fragmented idea of the self? Is what healing is all about. And this is the direction yoga takes. And I want to really quote J. Krishnamurti's definition of philosophy, because philosophy is usually seen as something very dry, very abstract. And J. Krishnamurti says it is the love of truth in daily life. That's such a beautiful definition. Love of truth in daily life, which means, first of all, I need to explore and understand what is this truth. And I have to have a deep love for it, a deep yearning for it. And it is in our daily life, the way we experience life, the way we live our life, our behavior, our thought patterns, our actions, our responses to life situations, everything is part of philosophy. And therefore, the way I would approach this whole second and third module is to go back to the fundamentals of the philosophy that Yoga Sutra provides, that many other yogic texts provides, and to see the person as a whole being. So the approach will be holistic, where we are not separating the body from the mind. You cannot separate the body from the mind. So I know that the Ayurvedic physician and any wellness professional will completely agree with it, right? It is a continuum. At one end, we have the gross body. At the other end, we have the very subtle awareness, which is even beyond the mind. We are made up of all of this and something more than that, that we are seeking to understand. And if healing can take an individual in this direction towards self discovery, towards becoming whole, then it will be complete healing. Otherwise, we are looking at curing or some temporary symptom management measures, which are necessary, essential, and maybe some people can only access that, and that's completely okay. But for a teacher or therapist, we need to have the larger picture. We can't become technicians, right? Where we're just looking at a symptom saying, what technique can I use to help the person to be free from that symptom? Because another symptom will come and something else will come. And the person is battling, struggling. So, how can I, as a teacher or therapist, be a companion for that person, be part of that struggle? It is okay to struggle. If we want to really work with the suffering and illness, we have to also accept that the struggle is very much part of our life. And then to also look at oneself, we are also going through all of that. And sometimes when we are experiencing the pain of the other, it impacts us deeply. Not just our family, but the people we are working with, and we need to be impacted. But also to hold the ground within us to say that, yes, I am impacted. Sometimes I really don't know what to do, but I want to help this person. I want to be with this person. I'm committing to journey with this person to help them find their inner strength and deal with the problem, and help them find that light within them to deal with this problem. So this will be the premise from where I will be looking at uh, yoga therapy. Yeah. So the second module will focus on the tools of yoga. So before we get to the tools, I will look at the philosophy, the principles behind yoga therapy that we operate from, the frameworks that we draw from Yoga Sutra, partly from Ayurveda, of course, that Dr. Pankaj will be dealing with more in detail. But drawing as a yoga therapist, how would I look at, say, very briefly, the doshas, the gunas? The Sankhya talks about gross to subtle and how the subtle is more uh, powerful than the gross. So, how to work with the breath. All of these principles we will be looking at. Seeing the person as a whole, right? Personalized approach and person centric approach, not a disease centric approach. So, whether the person comes with the arthritis or cancer or terminal illness, it is a person in front of us who's important, who's impacted by the problem. So, every point when they come through the different stages of recovery, through the different stages of treatment, and all that, we are meeting the person afresh to see what is bothering that person now, what kind of physical symptoms, how are they seeing it, how are they perceiving the situation, because it is only based on their perception of that reality that their mind and emotions and all of that are playing up. What is their role in the family? So what stage of life they are in? Is it a young person? Is it an older person? So that stage of life also matters, the roles that they play in their life. All of that we have to take into account. So the tools will be drawn based on this understanding of the person. Observation, listening, all of these are very important skills for a therapist. We are not just going into the session thinking, oh, I have the case history, I know what to do. Very often we are stumped, right? They give us a case history. When you meet the person, when you watch them breathing, you realize, oh, I have to approach differently. And there's a lot of fatigue sometimes, and the person says, I'm very fatigued, all of that, but they've climbed 2 stairs and come, they're working, they take the chemotherapy, they go and do their work. How do I integrate the practice into their daily life, right? So like Dhyana Bindu Upanishad says, Shiva is telling Parvati, there are as many asanas as living beings in this world. We don't have to take as many asanas. We may work with some 20, 25 asanas that are important for healing, and teach the principles behind how to apply these asanas, how to integrate the asanas with the breath, because breath is the healing tool here that we focus on, because the breath is the primary vehicle of the prana, right? The primary expression of the prana. So the idea is not about the structural work that we need to do here, functionally, how we can improve. How can we improve the physiology, improve the cleansing of the metabolic ways and the the side effects of the medication and all that, how to remove those toxins from the system, how to fill the person with, and how they can do something to fill themselves with fresh energy. And we know that oxygenation of the cells will really help fight cancer cells. So, all of that. And of course, looking at diet, but I won't go too much into the diet because we have people who will be handling that more efficiently. Um, then taking these asanas and saying, how can I modify? Okay. So whether somebody is going through a chemotherapy treatment, or anybody who goes through radiation therapy or surgery has a risk for, say, breast cancer related lymphedema, which may impact them immediately or after years. But it is also about preventive care. No? If you have somebody and you know that they have the potential for these problems, then you work with them in a way that they can prevent the problem. Or if they already have developed the problem, how to work with it so that we minimize the impact of the problem. And if it is just very early stages, can also reverse it probably. Yeah. So management of the symptoms, prevention of long-term problems, and preparing the individual from within. So we are not just going to do the work with asana and the breath, but pranayama to stabilize the mind, to help them access the deeper strength within them, to help them to develop a positive frame of mind so that they can look at the problem as not as a huge thing, but something lesser than who they are. And they have greater strength and potential to deal with it. And of course, in end stage cancer, to prepare the person for the eventual, uh, you know, moving, transitioning very gracefully to that which nobody can prevent. And it is important that we see death as a natural part of our living experience, right? You cannot separate it. And we don't need to talk about death. We really can work with the person to prepare oneself at every stage, right? With their own potential, with what they come with. And a teacher or therapist should be able to see that, even if they cannot see it, and help to bring that out. So, the yoga tools, we will look at it a little more in detail. Of course, we have 10 hours. Maybe we will spend 4 or 5 hours with that. Definitely one session on the philosophical background that will be the foundation for understanding healing, and application of the different tools. Of course, sequencing for different stages of recovery. So we have postures one can do in standing, seated, lying. We may not use much inverted postures, but there are inverted positions that can help one to sleep better, and help with different better circulation, lymphatic drainage, and all of that. Then we look at specific symptom management techniques and how to work with the deeper personality. The integrated approach means that one learns to work with other healthcare professionals and learn to see the scope of our work. I don't need to do the work of Ayurvedic physician. They are very good at it. They can do that work. I don't need to be a dietitian, but I need to be able to observe somebody how they're breathing and offer something appropriate. And sometimes, as a yoga therapist, we get really overwhelmed by the amount of medical information that is available. And I think I need to know everything about it. Of course, Dr. Balaji is going to talk about it, and he say, okay, we will take care of that. You don't have to take care of that. I just have to take care of the yoga part of it. And a teacher or therapist needs to know that scope and work within that scope and do the appropriate referral. And also, if we can work together as a team. So I work with an Ayurvedic physician, a homeopath, a medical doctor. I can always have conversations with them to see, okay, how are you looking at it? How can you give me some guidance on how I can work? Yeah. So working together as an integrated team will be the direction that we need to move. And I hope this particular program and the efforts of Haloma Yoga, I have been part of this on and off over the years, and I've really seen the kind of commitment that you bring into integrating all of this and enabling people by offering the right kind of education and building awareness. So I really wish that more people can take up this course and benefit from it. Do I have time? Third module? Okay. So third module is about the psychological aspect. Yeah. And yoga is for the mind. Let's not forget it. Even as we work with asana and pranayama and all that, underlying idea is that we are helping the person to understand themselves. And we are helping through practices, through the right kind of direction that we give to the person to balance the rajasic and the tamasic energies within their system and promote sattva. Sattva that can bring clarity so that the person can become more self aware. Better self awareness means I take charge and I begin to self regulate. I am not at the mercy of different practitioners saying, somebody told me to follow this, somebody else told me to follow this, and I'm totally muddled. And you know what happens when there's a diagnosis like this? Everybody is giving advice. Do this, do that. Have you tried this? Have you tried that? But that person needs to take charge. That person needs to take the responsibility and the decision maker because it's their life. So, how to enable that person to walk that path with that inner strength and clarity is what yoga will provide. And education is important. It's not simply teaching them a meditative practice or a visualization practice, but actually helping them to see how it works. Yeah. So, when you work with, say, visualization or you work with some simple rituals through the day, you start impacting the deeper unconscious part of the mind. And when the impact is happening from there, it may take a little while to touch the conscious mind, but it will radically change the experience of the person and promote healing in a very fundamental manner. We don't know, maybe remissions may happen, and the person may be able to see that this is much smaller problem. You know, today with a lot of information, people are getting more and more confused. And we have the Google doctors, we have now the AI doctors also coming in, where people are self-medicating. All these problems are happening. So how can the person really take charge, simplify their life, look at how to create space for practice, and work with the therapist on a long-term basis, come back and share about their deeper fears and understand, that it is possible for me to do something. Krishnamacharya said, if you can breathe, you can do yoga. So it really doesn't matter. I have worked with people with just diagnosis of beginning of cancer to fourth stage to people who, actually passed away a few days later. Okay. There was always something that they could do. And I was telling Shivani the other day, sometimes we even get the caregivers, the family members to sit together and do some chanting, do some breathing, and like some form of surrogate practice. So that person can simply lie down and receive that energy. And we may record something for them so that they can go back to it and work with it. So there is a lot we can do with yoga therapy at every stage of treatment, recovery, and whatever direction this takes us. Yeah. So maybe I'll stop here. If there are questions, I'm happy to take.
Thank you, Saraswati ji. And in fact, I would say that I wouldn't have started this program with the presentation. I think I should have put you forward to speak about the program because you have spoken the essence of this program, why even this program exists, and what this program plans to deliver. So thank you so much, Saraswati ji. This is like we are completely in gratitude to the universe that you are part of this program. Thank you so much. Now we would like to invite our next mentor, Dr. Pankaj Chansarkar, who is an Ayurveda Vede. He has also worked with us in geriatric teacher training course. And one thing which I always, one statement which I always keeps with me is that he says that your first pharmacy is your kitchen. And it sounds simple, but to take yourself towards the kitchen and prepare yourself something that can help you takes a lot of efforts and takes a lot of commitment and trust in your Indian pharmacy or your Indian kitchen. So let me invite Dr. Pankaj on the screen. I request Hello My Yoga team to please put him on the spotlight.
Namaste, namaste everyone. Thank you, Shivani for the introduction and bringing all of us together for a very genuine effort to prepare more and more well-informed people. Actually, so we actually are staying in a world where we are all surrounded by a lot of radiation, chemicals, pollution, preservatives, and all. So anything can trigger cellular multiplication or detoxification of or toxication of our cellular system. So we need a lot of people, well-informed people, to come together and bring in that wisdom and knowledge for helping people who are suffering from this disease called cancer. Very well said by Saraswathi ji that illness is only a part of you actually. There are many other aspects in your body and your system which are functioning optimally. So if someone is diagnosed with cancer, so mentally, physically, emotionally, people start like, okay, he's completely sick. That is not the case. Many functions in your body is functioning properly, and if we support those systems, the quality of life and the process of healing can be uh, remarkably improved. So that is the effort that we all are going to provide with in this curriculum, uh, so that people who are taking care of uh, suffering from like a person who's suffering from cancer, there are caregivers, the yoga teachers, the physiotherapists, the psychologists, and also all when this integration happens, it should be like hand to hand and supporting each other. So it is not like contraindicating anybody or over informing the person also. So because too much information is there online, so many things are there which people have tried, which worked for them, which didn't work for them. So all that information is there online, and people get confused whether to do it or whether not to do it, what is good for me and what is not good for me. So to bring in a clarity of knowledge and wisdom, this is an excellent program that Hello My Yoga team has been working on from some time, and I have been a part of the team, and we have, I would say, a good working relationship and frequency that matches with our thoughts and understanding of the concerns. So Ayurveda basically is a preventive care in cancer rehabilitation. Uh, there was a time where Ayurveda primarily was used and tried for cancer healing and treatment. And then there were many herbo-mineral medications and metals and all, which work really well for reversing the cancer care. Uh, which got further researched into many other oncological medicines. And so the mother of all the pathies is Ayurveda actually. So if you consider the herbs and the treatments that are mentioned in Ayurveda, which further got much more researched and developed into current oncological treatment pattern. So oncology should be the leader. The oncologist should lead the process, and Ayurveda, yoga, then psychology, and all other integrative pathies should support the person in the right way to choose properly what needs to be done and what needs to be avoided. So, in my curriculum, I will be explaining the concepts of cancer in Ayurveda, how it develops, and at what stage the person approaches the healer or the practitioner who is going to assist. So in such curriculum, there are a lot of things that changes in our body when a person is suffering from cancer. So we will understand the constitution of the person, like what is the constitution, what are the imbalances, what are the disturbances that imbalance is causing, what are the symptoms that are developing inside the body. And rightly said by Shivani ji that I always say that the kitchen is your first pharmacy. You don't have to rush to the doctor for every small and symptom or discomfort that your body is facing. So kitchen has many healthy spices which can be combined together to improve on the symptoms that the person is going through. Food is the medicine. It is very, very important what you eat, what you combine. Uh, the concepts of the biological clock, the concepts of the seasonal clock will be recommended in this. Because for a normal person, it is quite different. We can integrate a lot of things and choices can be provided. But a person who is suffering from cancer has a Agni, that is the digestive fire, which gets affected. It's Ojas, which is your vital energy, gets affected. So all that things which are depreciating and diminishing in your system needs to be supported so that the quality of life is better. Doesn't matter the outcome of the efforts that we put in, but at least the process should be like little bit helpful, maybe supportive for the person to be a little bit more positive, be more feel a little bit more healthier, and uh, with confidence deal with the process of the entire treatment pattern, whether it is radiology or whether it is chemotherapy or operative procedures, basically. So in each stages, different combinations of eating patterns, some very safe herbs and spices that can be combined together, can be used together without affecting the chemical therapy as such. So that all information will be provided in this curriculum. So it will be a kind of ready reckoner of what kind of symptoms can be treated with what kind of spices, and easily get rid of discomfort that person might be facing. Uh, the concept of Ojas is very, very important in Ayurveda. Ojas is our vital energy and vital force. With cancer in your body, the vital force reduces remarkably. How to maintain that, what kind of foods needs to be included, because the digestibility is important. Ayurveda says that you become what you digest. It is not what you eat. So if person is unable to digest or unable to process the nutrition, then no need to force that nutrition on that agni which is already compromised. So what will be the easy to digest food options, how best we can provide the maximum nutrition to the person without overloading the digestibility. So what is the sattvic meal plans and all, so that will be included in this curriculum. And the words in Ayurveda is swastasya swasthya rakshanam and aturasya vikar prashvanam. So we take care of the healthy, and whoever is suffering, Ayurveda supports and guides with the choices of herbs, spices, foods to lead a kind of healthy lifestyle and improve the quality of life, basically. So it's a well designed program which will give you the basic idea of how cancer develops in your system. What are the imbalances that starts happening on the level of constitution of Vata, Pitta, and Kapha? What happens with the Agni? What kind of symptoms that the body can indicate? What kind of support and help that we can provide through eating patterns and all, and what best we can do to support the emotional and mental balance as well, to build the confidence in the person and give the tools for the person to feel confident enough to handle his own sickness and illness, basically. So once a person is confident enough, positive enough, then a lot of things changes in our body. More the happy hormones in your system, the faster the healing and faster the recovery also. We have multiple cases of which I have been treating from many years, like for the uterine cancer or bone marrow cancer, breast cancer, different aspects. So in Ayurveda, there is a concept of dhatu. Dhatu means our tissue channels. So when we consume food, it is converted into the 7 dhatus that our body is made up of. So it is Ras, Rakt, Mans, Med, Asti, Majja, and Shukra. So at which stage of dhatu the cancer is developing, accordingly the choices of food, choices of herbs, and many other things changes. It works quite differently for a normal person, for a person who is suffering from cancer. So many things changes. Many different concepts of Ayurveda needs to be understood and integrated for the treatment or for the support system that we will provide. So all this will be in the curriculum, and apart from that, the changes according to the season, because cancer treatment is not like for a few days or few weeks only. So it lasts for a long time. So what changes needs to be done according to the season, according to the biological clock also, what food is best to eat in the morning, what is good in the night. So what will be the pattern of eating pattern and all. So that will be the part of this program. And all the teachers who are associated are like kind of Saraswathi ji, Rita ji, and Dr. Balaji. They will be working with yoga, psychology, and other patterns as well. So I will take care of the Ayurveda part, and a collective effort will generate a lot of informative and well-informed people who can then connect with many other people to help and improve their quality of life. So I compliment definitely the Hello My Yoga team and the efforts that Shivanji has put in all through this program. And I hope we get good enrollment for this program, because it is very important. As I said, if we go through the statistics, it's overwhelming. The Department of Oncology is flooding. So we all, many are suffering, really suffering. So people need to understand the concepts and give a right direction for whoever is taking care of cancer patient. So if well-informed peoples are there, then less confusion and proper milestones are achieved in the healing process. So I will hand over it to the Shivani ji, and hope to kind of help share the information that I have and knowledge that I have with people who enroll for the program. Thank you so much.
Thank you, Dr. Pankaj. And I think this is absolutely correct, and it's a harsh reality that the medical system is not bad. The medical system is extremely advanced and really good. But the problem is that the numbers are so overwhelming that the system is getting crushed. And it is very important for us to be aware and to be more informed, especially at this point of time when there is abundance of everything. So it is very important for us to not be misled, but be rightly informed. And the purpose of this program, and how Dr. Pankaj has said, that it is very important for us to have that perfect balance, what to apply and where not to. So now I'll invite the first mentor of this program, who will be helping us to create the foundation of this program, Dr. Balaji. Dr. Balaji is an MBBS professional and also comes with a yogic background. So that gives him a perfect balance to understand his students very well, that what they expect, and help them to draw the perfect boundary and become more sensible to the medical boundaries and medical systems. So, Dr. Balaji, namaskar, sir.
Namaste. Namaste to all of you. Hope I'm audible.
Yes, yes.
Good morning from Pondicherry. First of all, I want to thank Shivani ma'am and Hello My Yoga team for asking me to be a part of this wonderful initiative. I asked Shivani ma'am first when she approached, ma'am, I'm not an oncology specialist. My specialization is when I was 8 years old, I joined yoga class, and my guru is Dr. Anand Yogi Bonani. And for the 30 years, I've been training in yoga therapy, and I'm still learning under him. Then I went into medical school, finished my MBBS. Then I specialized in emergency medicine. Then diabetology. I did the fellowship in diabetology also. So and I asked Shivani ma'am, I'm not an oncology expert, but how you want to be me in part of this kind of module. So she told, you are a person who understands both yoga and modern medicine. So it would be nice you join in this program. Then I thought, okay, whatever way we can help the people, it is better to do it. So I asked permission to my guru, Dr. Ananda. He told, go and do your best as you do always. So I just felt very happy because every day morning I used to spend with Dr. Ananda sir in our university where we integrate yoga therapy with modern medicine, and evening work with my alcohol and cannabis de-addiction treatment, and night the emergency stuff. So there's a balance between acute and chronic disorder every day. Both modern medicine and yoga therapy, the basic rule is only one thing. Maharishi Patanjali says, Heyam Dukkam Anakadam, prevent those miseries hate to happen. That was the modern medicine also says, prevention is better than cure. And both yoga philosophy, yoga therapy, and in the modern medicine, we do the same things. First is do no harm in medicine, and yoga also says ahimsa. So that's a basic principle we follow in our therapy. And coming back to this module, I am going to deal with what is cancer, what are the different aspects of cancer, what is the difference between benign and malignant, what are the treatments available, and when we have to go for surgery, and what are the red flags. So these are the few things I'm going to discuss in module 1 and setting a basic platform of understanding the cancer, the oncology part. And the most important thing is cancer is not only affecting the particular family, particular person, it affects the whole family. The next important thing is it is going to be carried into the next generation also. So recently, we have seen a family out of five sisters, three sisters had cancer, and three of them had different types of cancer. And everyone came into the diagnosis into the later stage only because they don't have any symptoms. And with a few symptoms like indigestion, chronic cough, chronic cold, headache, they came and evaluated and found out that they are in the end stage of cancer. So now we are afraid. It is difficult to counsel that person itself to accept that they have a cancer. And then the next step is to make the family understand what this person is going through. And the most difficult part is to educate the future generations because they may carry the genes. And at any time, if they are not expressing their siblings in the future, they can express the genes. So this is a very critical part, and understanding these things and educating the people is very, very important. And when to go for it, that is the key aspect here, because a little symptom, what we understand is even a simple symptom like indigestion, a headache, we should not go to a medical shop and take a pill, and we should do our work. Okay, if something is disturbing you, you have to definitely go and get tested, investigated, see a proper practitioner. See, as an allopathy doctor, we see a lot of cases. What is the advantage of yoga or yoga therapy is the disadvantage of modern medicine. What is the advantage of modern medicine is the disadvantage of yoga or yoga therapy. What I mean to say is it's time consuming in yoga therapy. You have to spend your own body, you have to spend your own time and you have to spend at least 30 to 45 minutes every day. But in modern times, people don't want to do that we see often in our clinics. They want to take a pill. That's all. Give me a pill, less than 1 minute, I will do my job. So this kind of attitude should be changed. So that's why I told advantage and disadvantages. Whenever we see a case, we make them the vitals are stable, the ABC, the airway, breathing, and circulation are stable. The next thing, as an integrated practitioner, what I will do is we'll go and sit and do a lot of counseling. Counseling is an important part of a therapy. A therapy is not completed just by giving a drugs, injections, or telling about the investigations. You have to speak about the person's 24 hours activity, which includes diet, hydration, sleep, and how they involve in the society. So without addressing these aspects, definitely a therapy is not complete. And this is what we do in our integrative ISCM, Institute of Salitogenesis and Complementary Medicine at Sri Balaji Vidyapeeth, under the leadership of Dr. Ananda sir. And here get more success because it is an integrative clinic. But in the emergency clinic, I can't able to tell a person to come for counseling and all because they are already in the peak stage of stress, having some kind of acute disorder. So, and proper education should be given to the people to understand, because taking medicine is not only the solution for the disease. There is way beyond that. The most important thing is prevention. Then you have to control the disease. You should not go under the control of the disease. That is what we say. And if complications happen, the first time is prevention, then controlling, then prevention, the complication. If the complication is happen and there is no other choice, then we have to accept the disease. And we have to accept that we are going to, the body is going to move from this Sthula Sharira to go away from it. And we are going to, in other transformation, they have to accept it and they have to improve the quality of life. That is a core principle. Improving the quality of life in all the aspects of WHO definition is the core aspect of treatment according to us, actually. Making them to feel better in the physical, mental, social, and spiritual well-being. That is the concept of integrated medicine we are doing. So, as I said, this is the first teacher training course I am involved out of the tradition of Dr. Ananda sir. So I have met Shivani ma'am once, and I am deeply inspired with the work of her and Aloma Yoga. And first, I'm seeing all of the mentors here, Dr. Pankaj sir, Saraswathi ma'am, and Rita ma'am. And I would like to work more, and I will also like to learn a lot from you all. And hope this course will make a good impact in the society, and it gives a lot of message why this integrative medicine is the need of an hour. Okay, we are not talking integration is the key. It was there before as alternative therapy. Alternative therapy is whether yoga or the allopathy. Then that is not a thing. Then complementary. Complementary is then we can claim that I work better, allopathy is not better. This sort of mismatch will come. That's then only the term generated as integrative medicine. We work as a team to improve the overall quality of a life of the patient. That is the motto of integrative medicine. And I hope this program will be very successful and it will go further. And I really thank Shivani ma'am for giving me this opportunity. Looking forward to this module. Thank you.
Thank you, Dr. Balaji. And since you have spoken about Dr. Ananda, I would like to share an episode. There was this conference, and there's this person comes to him and says that my grandmother died because of colon cancer. My mother died because of colon cancer. So, shall I remove the colon from my body? So, Dr. Ananda said, rather than that, change the pattern. Look at what the pattern your mother has. Look at the pattern what your grandmother had. And now it's your chance to change the pattern rather than removing the colon. So, Dr. Balaji, you on the team is because you give us that perfect balance. Because you have an understanding of yogapathy as well and allopathy as well. And you have correctly said that integration is the key. And that's what we want to educate, aware our wellness professionals about. So, friends, after 50 hours of learning with Saraswati ji, Dr. Balaji, Dr. Pankaj, then comes how to put all of this together. And for this, we have Rita Date, who's nutritionist, health journalist, author of a book called Fighting Cancer with Thali. She's a yoga practitioner. She runs her own studio at the Pune, the Breathing Room. She's founder of Real Food India. So let me invite her on board. Please, I request Haloma Yoga to please put her on the spotlight. Namaskar, Rita ji.
Hello, thank you. Firstly, I'm thrilled to be amongst all these esteemed people, and thank you, Shivani, for inviting me. I have an accent. I grew up in the US, but I've been in India for the last 35 years, and yoga has always been part of my life. So, what am I going to do in my module? Most of you have done it all, but I'm going to put it all together. You know, I used to volunteer at a cancer care center, giving nutrition advice. And what I have found there is people really don't want to know at that stage what to eat. They want to just be heard. So I will be teaching a lot of listening skills to the students. And the other thing, there's two main things. That is one. And we will be listening to each other. We will work with each other in my module. The second thing is this work takes a toll on you. So, you know, we need to take care of ourselves. And we need to be grounded in our own practice. We should not, a lot of times as yoga teachers and practitioners, health practitioners, we ignore our own internal bodies. And I will be reinforcing that again and again. And of course, the caregivers. Caregivers are a very important part of this whole module, all of our modules, I think, because in addition to just taking care of the patients, the caregivers often need a lot of attention. Their health also, their food intake, their movement, their time, everything goes haywire during this process. And we will be also talking about how to deal with that and putting this all together. So listening, taking care of ourselves and the caregivers, and yeah, that's what I'm going to concentrate on. And again, thank you, Shivani, for including me in this. And I look forward to working with you. And this, I have seen cancer close hand with family members, and this is the need of the day. You know, when I wrote my book, Fighting Cancer with the Thali, the statistics are much less. It's just going higher and higher, unfortunately. And just going and taking the medicines are not enough. We need all of these complementary therapies, and I do hope that a lot of people take advantage of this course. So thank you all.
Thank you so much, Rita. And absolutely, we agree with you that the numbers are overwhelming. The numbers are, we could see the rise in the cancer patients every day. And the solution or the answer is not only medication, but we need an informed supportive care. And for that reason, this program exists. So, going back to my presentation, however, I don't feel like giving the presentation as the essence has been already mentioned so beautifully by the teachers. But I will quickly take through the recap that this is a 55 hours program. I hope everyone can see my screen. Can I have the thumbs up, please? Thank you so much. So I'll quickly take you to the recap of this program. This is an 100% online digital learning where the program will be delivered through live Zoom sessions. The 55 hours program breakup is that the first module under Dr. Balaji's mentorship, it is cancer physiology and red flags. That will be 12 hours. Then followed by applied oncology yoga therapy by Saraswathi Vasudevan, 10 hours. Followed by third module, psychological and emotional healing, again by Saraswati Vasudevan ji, 18 hours. You can understand why we have given 18 hours to this module. It's more about wellness. It's more about coming out of that trap and taking care of that person, as in that person understand him or herself during this journey. So the fourth module is Ayurveda and Recovery Lifestyle by Dr. Pankaj Chansarkar, again 12 hours. And then Integration and Closing by Rita, 3 hours. So friends, one integrated curriculum and multiple perspectives. The people who know about this program, and we have some of our previous batch students also, previous program students also, that Hello My Yoga offers another 2 specialized TTCs as well, prenatal, postnatal yoga teacher training course that purely talks about women wellness from fertility till postpartum. Then comes geriatric care yoga teacher training course. We also have a special space for senior citizens. So that's why we have now with this, we have the third teacher training course on cancer rehabilitation and integrative healing. Friends, is this training for you? So I'll say that a lot of yoga teachers, a lot of wellness professionals, they struggle away with this question that I'll never meet or I haven't ever met somebody affected by cancer. I think the better question to is that when I do meet them, I should feel prepared to support them responsibly. So that should be the question. And if you are ready to answer that question and you want to fulfill that question in this similar way, I would advise you to join this program because the goal is not to make you an oncologist. No, absolutely not. We are making you an informed yoga professional who knows what to be done during the class, who doesn't walk into the class with the confused setup, do not take his patient only with Karuna. Yes, Karuna is an important part of it, but with proper knowledge, with proper training. Yes, if cancer care is entering your teaching journey, I'll ask you to prepare before the responsibility arrives. And this preparation can be done with this program. It is a 55 hours, 100% live on Zoom, starts on 22nd August. The session calendar is already included in the program brochure. If you haven't received the program brochure, then you know whom to contact. Uh, it's info@hellomyyoga.com. You're already getting WhatsApp messages through the number 893-8888-444. So you can always reach out to us, drop us the message. The program fee is 54,500, but we have 10% discounts going on and we have 3 installments available. Similarly, for the international participants, the program fee is $750 and we have installments. Friends, I'll say the program is meant to educate, to prepare, to train you. That's the purpose of this program. If you are interested, Haloma Yoga is ready to take care of what is your challenge in not enrolling. Let's understand your challenge and then help you out that ways. But if you are interested for this program, just don't give a second thought. Pick your phone, give me a call. That's it I can say.